Welcome to the demonstration of the mini-sim for wrist blocks or forearm blocks. The molded simulator is carefully manufactured to accurately imitate human tissue, the nerves, and the bone structures. This allows the user to enjoy a realistic experience when training for nerve blocks. The data for each model is obtained by three-dimensional CT scans, which are then used to 3D print the model itself. Each model features a high level of tactile and anatomical realism. The model can be rotated in any position deemed necessary on the tray. The mini-sim is capable of being injected with real fluid, usually sterile water, so that the student can practice proper injection techniques to develop their skills and achieve successful median and ulnar nerve blocks. The tray is designed to prevent soiling the work surface after injection. So let's get scanning now and see how the mini-sim landmarks look on the ultrasound for ourselves. First, we will orient the transducer. Let's decrease the depth because that would be helpful. Typically, for this particular block, we place the transducer above the palmar crease and above the tendons of the flexors of the hand. And here you can see how reliably and accurately these surface landmarks have been reproduced in the mini-sim. As we place the transducer over the surface, we can immediately see the radial artery and the ulnar artery on the ultrasound. We also see the ulna and the radius bone. In between the two bones, superficial to the radius, is the median nerve. We can practice scanning proximally and or distally until we see the nerve entering the carpal tunnel. We can also scan medially to identify the ulnar nerve and the ulnar artery. As in a living patient, if we scan more distally, we can see that the artery and the nerve come together, whereas when we scan more proximally, the artery and the nerve separate. Now, let's perform the median and ulna nerve blocks. Normally for this procedure, we would use 25 gauge needles. Here, we will use an out-of-plane approach. And this is the needle. It enters the skin close to the transducer. Here, we can see the needle passage close to the nerve. Every time the needle is advanced, we slide the transducer slightly in the direction of the needle advancement. And here we can see the tip of the needle positioned next to the radial nerve. This is an out-of-plane technique. And here's the injection of water right next to the radial nerve. Here, we can see the swelling around the nerve. We can adjust the needle position by pulling back a little bit, which results in tissue swelling next to the radial nerve. Let's do an in-plane technique now. With the in-plane technique, we place the needle parallel to the transducer and guide the needle a little steeper in order to reach the median nerve. We adjust the angle of the needle insertion based on the initial image of the needle. Here, we see the needle underneath the median nerve, and this is the injection of 1 milliliter of water. The mini-sim allows the trainee to actually perform injections in order to practice their technique. Now, we have the median nerve, the ulnar nerve, and to reach the ulnar nerve, we're going to use an in-plane technique while avoiding the ulnar artery. So there it is. Needle insertion to reach the ulnar nerve. Now we can practice injection of the fluid. The mini-sim allows one to practice recognition of every important anatomical landmark, both using the surface anatomy as well as ultrasound imaging, and then confidently and safely perform the actual procedures. The included tray serves as a convenient method of accumulating the fluid that has been injected.